Hi, Bob Forster here again. I'm a physical therapist, been working with the Addaday company designing products for your needs. And today we're going to talk about the plantar fasciitis, a very common injury, occurs in runners very frequently. And it's a mechanism of injury is usually overpronation. But what happens with that is a lot of tightness through the calf and the foot, and we're going to teach you how to work out that tightness. So starting with the gastrocnemius, calf muscles, we're going to do our typical motions. You can hold a Addaday stick, whichever is comfortable for you, but you want to go on the inside, down the middle, the outside, and then you want to get to the problem areas, up in the calf, do a little circular massage on the belly or the head of the calf muscle, and work into the belly. Below the calf muscles is the soleus, and that is also the muscle that feeds into the Achilles tendon. The fascia that goes from your calf through the Achilles tendon attaches to the heel and continues on to become the plantar fascia under the foot. So by working the calf and the soleus, you're going to relax these muscles, get them to reduce their muscle tension and their tightness, and it's a good place to start. Next, we're going to move to the foot. Okay, using the Addaday stick for plantar fasciitis, it's really quite simple. It starts seated position. We go right from the back of the heel all the way up to the toes, right down the middle. Then we angle the foot between two balls, and you're getting one ball or gear, massaging the bottom of the foot and one massaging the side. It feels really good. Relaxes those muscles. Go back to the middle and then turn in. So again, one gear is on my foot, the other gear is on the inside of the arch. You can use the small red gear as well, which really works well to get down there. When we find a sore spot on the plantar fascia, just like we've taught you before, we're going to do a little bit of cross fiber type of technique. So you might move your foot, keeping your foot in touch with the ball, but you're moving back and forth right on the sore area, and that's going to help a great deal. So it's inside, down the middle, and the outside. How long do you do this? Maybe 2 or 3 minutes per foot. See how you react to that. If you're okay, you might move up to 4 or 5 minutes, but you don't want to get the tissue irritated, specifically in the back where the plantar fascia might be most sensitive. We're really trying to get the rest of the plantar fascia to stretch out and give some relief to where it attaches back at the heel. So you can also work the plantar fascia in standing to get more force. I suggest you start sitting, work with that for about a week. If it all goes good, then you can get up and get more force by standing. Now, of course, most of my weight is on my left leg, but I'm rolling the right foot once again down the middle on the outside, always going all the way from the heel to the toe. Come back and go on the inside, heel to toe, and it feels really good through the arch. You have to judge how you feel when you get done this. You should not be overly tender and sore, but it's important to work out that fascia. So along with stretching and icing and picking up your cadence when you run a shorter stride length, those are the measures you can use to get rid of plantar fasciitis. Use the Addaday stick to help work out the tissue. We're stretching and icing and improving your gait, and you're going to do better.